This was a study to assess the feasibility of doing this assay in a real-world setting. And what we observed was that it was not easy because sample collection was really difficult. But from the 55 patients that we already started with a trial, only 26 have available paired samples with both flow cytometry MRD and cell-free DNA MRD. And we observe a really strong correlation between the cell-free DNA and flow cytometry MRD, but still some discordant results. So overall, we think that it's feasible, but it's not really easy to use it in a real-world setting. And there are still some pitfalls that we have to address further.